Howdy, Michael Davies here with the pharmaceutical company. We will talk a little bit about the use and dosage of the drug and some of the side effects this medication. Amoxicillin is a penicillin antibiotic that fights bacteria. Amoxicillin is used to treat many different types of infection caused by bacteria, such as tonsillitis, bronchitis, pneumonia, and infections of the ear, nose, throat, skin, or urinary tract. Amoxicillin is also sometimes used together with another antibiotic called clarithromycin, Biaxin, to treat stomach ulcers caused by Helicobacter pylori infection. This combination is sometimes used with a stomach acid reducer called lansoprazole, Prevacid. You should not use amoxicillin if you are allergic to any penicillin antibiotic, such as ampicillin, dicloxacillin, oxacillin, penicillin, or ticarcillin. To make sure this medicine is safe for you, tell your doctor if you have kidney disease, mononucleosis, also called mono, diarrhea caused by taking antibiotics, or food or drug allergies, especially to a cephalosporin antibiotics such as Omnicef, Cefzil, Ceftin, Keflex, and others. It is not known whether this medicine will harm an unborn baby. Tell your doctor if you are pregnant or plan to become pregnant. Take amoxicillin at the same time each day. Some forms of amoxicillin may be taken with or without food. Check your medicine label to see if you should take your medication with food or not. Shake the oral suspension, liquid, before you measure a dose. Measure liquid medicine with the dosing syringe provided, or use a medicine dose measuring device, not a kitchen spoon. You may mix the liquid with water, milk, baby formula, fruit juice, or ginger ale. Drink all of the mixture right away. Do not save for later use. You must chew the chewable tablet before you swallow it. Swallow the regular tablet whole and do not crush, chew, or break it. You will need frequent medical tests. If you are taking amoxicillin with clarithromycin and or lansoprazole to treat stomach ulcer, use all of your medications as directed. Read the medication guide or patient instructions provided with each medication. Do not change your doses or medication schedule without your doctor's advice. Use this medicine for the full prescribed length of time, even if your symptoms quickly improve. Skipping doses can increase your risk of infection that is resistant to medication. Amoxicillin will not treat a viral infection such as the flu or a common cold. Do not share this medicine with another person, even if they have the same symptoms you have. This medicine can affect the results of certain medical tests. Tell any doctor who treats you that you are using this medicine. Store at room temperature away from moisture, heat, and light. You may store liquid amoxicillin in a refrigerator but do not allow it to freeze. Throw away any liquid medication that is not used within 14 days after it was mixed at the pharmacy. Get emergency medical help if you have signs of an allergic reaction to amoxicillin, hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Call your doctor at once if you have severe stomach pain or diarrhea that is watery or bloody, even if it occurs months after your last dose. Tell your doctor about all your other medicines, especially any other antibiotics, allopurinol, probenecid, or a blood thinner, warfarin, Coumadin, Jantoven. Some side effects of amoxicillin may occur that usually do not need medical attention. These side effects may go away during treatment as your body adjusts to the medicine. Also, your healthcare professional may be able to tell you about ways to prevent or reduce some of these side effects. Check with your healthcare professional if any of the following side effects continue or are bothersome, or if you have any questions about them. Less common, bad, unusual, or unpleasant. After, taste change in taste. Usual adult dose for Helicobacter pylori infection. Immediate release, dual therapy, 1 gram orally every 8 hours for 14 days in combination with lansoprazole. Triple therapy, 1 gram orally every 12 hours for 14 days in combination with clarithromycin and lansoprazole. Usual adult dose for bronchitis, immediate release, mild, moderate, or severe infection, 500 mg orally every 8 hours or 875 mg every 12 hours. Use for the treatment of infections of the lower respiratory tract due to susceptible, only beta-lactamase negative, isolates of Streptococcus species. IDSA and American Thoracic Society, ATS, recommendations: pneumonia immediate release, 1 gram orally 3 times a day. Patients should be treated for a minimum of 5 days, be real for 48 to 72 hours, and have no more than 1 community-acquired pneumonia, CAP, associated sign of clinical instability before discontinuing therapy. Used in combination with other medications. Current guidelines should be consulted for additional information. Amoxicillin is an antibiotic that kills bacteria by inhibiting the synthesis of cell wall mucopeptides, crystal lattice-like structures composed of amino acids that make up the cell wall. This weakens and destroys the bacterial cell wall. Amoxicillin has a similar action to ampicillin. Amoxicillin belongs to the group of medicines known as penicillins. Upsides active against bacteria that commonly cause ear, nose, or throat infections. May also be used to treat infections of the genitourinary tract, skin, or lower respiratory tract caused by susceptible bacteria. Specifically active against aerobic gram-positive bacteria, aerobic gram-negative bacteria, also has activity against Helicobacter pylori, a bacteria often associated with stomach ulcers. Amoxicillin, when used in combination with other medicines, such as lansoprazole and clarithromycin, can help reduce the risk of duodenal ulcer recurrence. Usually well tolerated. Downsides: if you are between the ages of 18 and 60, take no other medication or have no other medical conditions, side effects you are more likely to experience include nausea, diarrhea, abdominal pain, headache, taste perversion, and skin rash are the most common side effects, occurring in less than 10% of people who take amoxicillin. May cause an allergic reaction in those allergic to penicillin. The overall incidence of anaphylaxis is rare, less than 0.01%. Not active against beta-lactamase producing strains of bacteria. Staphylococcus bacteria that are resistant to methicillin oxacillin should be considered resistant to amoxicillin as well. Severe diarrhea associated with Clostridium difficile is a potential side effect of almost all antibacterial agents, including amoxicillin. The risk of rash is high in people with mononucleosis. Administered ampicillin-like antibiotics such as amoxicillin, and amoxicillin should be avoided in these people. May cause false positive results for glucose in some urine tests. Response and effectiveness. Amoxicillin is rapidly absorbed after oral administration and peak levels are reached 1 to 2 hours after dosing. However, it may take up to 24 to 72 hours of regular dosing before infection symptoms start to abate. Amoxicillin is effectively distributed throughout most body tissues and fluids. The exception is the brain and spinal cord, where it only penetrates if the meninges, the membranes that enclose the brain and spinal cord, are inflamed. Interactions. Medicines that interact with amoxicillin may either decrease its effect, affect how long it works for, increase side effects, or have less of an effect when taken with amoxicillin. An interaction between two medications does not always mean that you must stop taking one of the medications. However, sometimes it does. Speak to your doctor about how drug interactions should be managed. Common medications that may interact with amoxicillin include allopurinol, may increase the incidence of rash. Anticoagulants, blood thinners, such as warfarin, may prolong bleeding time. Oral contraceptives may decrease absorption leading to reduced efficacy. Other antibiotics, such as chloramphenicol, sulfonamides, macrolides, and tetracycline probenecid, may increase blood concentrations of amoxicillin. Amoxicillin may cause a false positive reaction for glucose in the urine with copper reduction tests, egg, Benedict's or Fellings solution, but not with enzyme-based tests. That's all for today. Subscribe to the Pharmacological channel and stay with us. Good luck.